Welcome to CoreLife Clinical Orientation. Let me begin by thanking you for taking your time out of your busy schedule over the next 20 minutes, spending your time with me. It is a privilege and I appreciate your attention. I look forward to your feedback in terms of how much this information impacted your life because I know it will. My name is Dr. Anessa Hunter. I am a naturopathic doctor and a clinical nutritionist. I have been in clinical practice for over 15 years, and in that time, I have enjoyed a tremendous level of success from both in person visits to online sessions. We at CoreLife Holistic Wellness is located in McDonough, Georgia, which is south of Atlanta. In getting started, I think it's important because it is a popular question that comes up a lot to share with our clients. Some personal history in surrounding how and why we started Core Life Holistic Wellness. It really stems from some personal tragedy as it took place in my own life many years ago. I had a severe accident while serving in the military. I was not responding favorably to the pharmaceutical medications that were being administered to me. Those medications had some severe side effects, which were very scary to be exact. I was very agitated, disoriented. My family and friends, they were very concerned that this was harming me. So after struggling for some years, watching me go through this pain, one of my family friends suggested that I try nutritional response testing. She had some other holistic procedures she wanted me to try as well. She said she would basically guarantee that it would relieve some pain and help me to walk a little bit better than what I was walking. I just knew it had to be a better way. So I'm like, yes, let's try this. So she did some muscle testing on me, showed me whole food supplements, showed me how to do reflexology on my hands, administer self Reiki. Fast forward, I started feeling great. I was walking without any equipment. The pain level was down tremendously. I was disoriented anymore. I wasn't agitated anymore. I was feeling good, better than I felt for some years. Fast forward, I retired from the military. I went to school. I got my clinical nutritionist certification. I got my naturopathic doctor's degree. I went on and pursued other natural therapies to assist me with my own degree of healing, oncology, lymphatic massage. These things expanded my health tremendously. It helped me tremendously. So I'm like, I have to share this. So that's how Core Life Holistic Wellness got started. With these natural protocols, using the whole food medicine, the nutritional response testing, these things changed and protect my life, my health, my husband, and my children. My grandmom always told me that I'm a lifetime student. I wear that badge proudly because I love to learn and I share what I learned. So over the years, my nutritional therapy practice has grown. And it's only because of one reason and one reason only. People are looking for good quality solutions. They're looking for good quality solutions for their health concerns. No more band aids. They want real solutions. And here at CoreLife Holistic Wellness, that is what we provide. Now, some answers or some solutions, part of that solution package. It is to understand there's 5 key principles that you need to be aware of in order to be successful as possible with nutritional therapy. The first principle that you need to understand is the restoration of health. It is a process, not an event. Certainly, certain events like the one I described from my own history will put you on a path for searching for better knowledge, better information about health. It certainly did with my family, and it can happen to you as well. The process of health restoration takes quite a bit of time and dedication to the right disciplines. One of the other things we need to be aware of is under principle number 2. Most people ask questions like, why do I feel the way I feel? And I can assure you from 15 years of clinical experience, there's 2 reasons why the human body will experience ill health. Number 1, under principle 2, the absence of something the body wishes was there. The right nutrition, the right enzymes, the right protein, carbohydrates, vitamins, and minerals. These types of things have to be present in order to perform optimally. Also, there can be the presence of something that should not be there, like a pathology or a certain chemical, a metal toxicity, or a sensitivity to a certain food that has not been identified properly. Both are usually what most people are experiencing, and when they come to our clinic, we identify the absence of what needs to be there or the presence of what should not be, and we help people eliminate those and add back what's needed. Under principle number 3, it's most important to formulate an individual solution for each client we see. We want to know the answer to 3 specific questions. And these answers, I'm certain you've probably asked but never found the answers to until now. That is, where is the stress in my body? What could be causing it? How do we fix it? These are important questions to have the answers to. In principle number 4, here is where we get the answers. Your body has a blueprint that's just unique to you. As your fingerprint or the iris of your eye, this will guide us on our journey to restoring your health and specifically answers to principle number 5. What order is the stress in the body? What right thing can we use to clear it? And what right amount of time? And that's the real formula for restorational health. And it works every time it's followed. It has to be followed properly. And it has to be followed over a period of time. And you notice right there, it says healing cycles. We live in a day and age now where most people are so groomed into what I call quick fix and convenience living. That is, they don't have the result in the next 2 minutes from taking this tablet or taking that capsule. That wasn't the right thing for them to do. So we try to educate our clients far in advance that the healing cycles in the human body is a minimum of 12 to 14 weeks of doing and handling things in the right order with the right thing the right amount of that thing and the right of amount of time. That's the four pieces to the principle number 5, and they have to be understood. You could go through several of these healing cycles in your restorational health. Once you understand these 5 key principles and how they apply to you, we refer to these 5 key principles as the structure of flexibility. We have to be able to have a disciplined approach to your health, but at the same time have flexibility within the structure to be specific to your needs. Many times over the years, people have pointed out to us they've taken supplements in the past. And there's some key points that we need to understand about nutrition is primarily used in the human body. 2 ways it is: 1, a fireman, and 2 is a carpenter. Okay, let me explain. You don't send in a carpenter into a burning building, so you don't need to send in nutrition geared to restore function of the heart into a body that's suffering from a viral activity or an immune challenge that's stressing from the heart. You always send in the right fireman or the right nutrition for that supports the normal function of the immune system then when that is handled properly. That is only time is handled properly. You send in a nutrition to restore normal function to the heart. You never get the two mixed up. And when they do get mixed up, that's when we have terrible results. Let's see what we can do to put this puzzle together, shall we? We call it 4 pieces to the wellness puzzle. These 4 pieces are addressed during your very first visit. Here they are. Number 1, we do a thorough case history. We need to know what you've done to yourself in the name of healthcare and what you have allowed others to do to you in the name of healthcare. 2, conduct a system survey. Many people have told us over the years they've gone to different clinics, they've filled in the little circles or the little check mark box under mild, medium, or severe, surrounding a host of different symptoms that they might have been experiencing. Some of those symptom surveys may have had 50 to 75, maybe even 100 questions on it. The system survey we use in our office, it has over 220 questions on it. And it was formulated by a medical doctor in clinical nutrition. And this was done well over 50 years ago. And we found it to be an excellent guide to point us in the right direction to look for the possible stress, whether it be your thyroid, whether it be your heart, kidneys, etc. Number 3, we perform a neurological exam known as nutritional kinesiology. Nutritional kinesiology is the clinical term used to describe a simple muscle testing. Many people listening to this presentation have experienced muscle testing in the past. They may have experienced it through their chiropractor, through their massage therapist, acupuncturist, etc. Many people use various variations of kinesiology to determine stress patterns along the nervous system pathways over specific organs of the structure. And when it's used properly, we can have a wonderful guide. So let's say we perform one of these neurological exams. Nutritional kinesiology, and the liver shows up as being one of the areas of stress. Well, we know there are several things that can stand in the way of an organ or a system of the body's ability to perform. So, listed in this particular slide of the top 5 that we can find and clear successfully on a daily basis is number 1, food sensitivity. The person may be eating foods such as grains, sugars, dairies. The body wishes you would stop. Stop and get the right enzymes in place to clear up the sensitivity itself. Number 2, it could be an immune system weakness for pathology such as viruses, parasites, fungus, or bacteria. When we find this on our clients, we inform them that we are obviously not diagnosing infection, but we're identifying the weakness immune system that with the proper nutritional therapy and the proper dietary lifestyle modification, they can help the body restore normal function in this area. Number 3 and number 4 seems to go hand in hand, and that is our air, water, and field pollutants are at an all-time high, as we all know. Metal toxicity, chemical poisons, these are types of things that can accumulate and overwhelm the body's natural detoxification process. There are nutritional protocols that we can use to restore the function here as well. So finally, one of the most interesting stressors that can stand in the way of optimal health is scar tissue. Topical scars in the body, these are known to produce severe neurological stress and can be the underlying culprit of chronic concern. The next visit, we present the client with what we call a program of care. This is a 5-page document which outlines the personal program that we're going to take this client through for the restoration of health, restoration of their health. The first thing it talks about is what I refer to as the trial period. We see clients on a weekly basis for about a 15-minute visit, which, by the way, is twice the national average that people get to spend with a medical doctor. We do that type of weekly visit for the first 6 weeks. Now, during that time, we're evaluating several key areas. One is the person's turning in their food log weekly. That's right, that's right. We're going to do food logs. We want to see your breakfast, lunch, dinner, beverages, and snacks for the first 6 weeks. This will help you modify whatever changes need to be applied over those 6 weeks and beyond. We also want to make sure that you are getting all of your questions answered, that you're being exposed to other continuing educational opportunities that we have, that your program is stable, that you are seeing changes, etc. So we really spend a lot of time focusing on some key feedback that will help us make certain that we are going in the right direction in your case. Once we've gotten through the trial successfully, then we graduate you to every couple weeks visit. And we keep it at that frequency for about 3 weeks until we know that you are stable you are improving, and that you are seeing the results that you want to see, that we know everything is going in the right direction, then we graduate you into a more of a maintenance type program. Upon entering this maintenance phase of your program of care, we will see you once a month for about 3 visits, then graduate you out to once every 2 months for about 3 visits. Then finally, you are placed into the maintenance phase. This means a visit once every quarter. We get to see you for your follow up visits. In between those visits, you will be exposed to a lot of continued educational opportunities through our YouTube channel, Facebook, Instagram, live events, etc. So we're excited of being able to offer all of that to all of our clients. The program of care outlines what our office visit fees can be. The follow-up visits are $45. Seniors are 65 and older. They receive a discount. Plus, we all offer a military discount as well as a professional discount to our first responders with proper ID. And children are seen in our office at $35 a visit. And in the program of care, there is additional savings for our clients who choose to use them. The nutritional therapy side of the program of care can run anywhere from $2 to $4 a day, or around $60 to $100, $120 per month. It depends on the person, it depends on the case. Some is more, some is less. Depends on what we find. It is very simple to redirect the money you're already spending, say from Starbucks, and putting that into your own health restorational program. Here's your next steps to your own personal health journey. Contact us here at CoreLife Holistic Wellness at 770-906-3257 to schedule your appointment. And because you've taken the time to invest in watching this presentation, you get a complimentary visit here with us. So in closing, I want to thank you for taking the time out of your busy schedule to be here with me. We at CoreLife Holistic Wellness, we have a joyful obligation in terms of sharing this information with you and how it can impact your life. And we look forward to seeing you and to servicing you in the future.